So I'm trying to pick out my plan. I have to decide if I want a high deductible, do I want a high copay, or a high monthly premium.
Would you rather pay the money up front or you want to pay it later?
I don't know. What's better?
That totally depends on how you like it.
Well, I guess I would like to pay it. I guess I would like it to be future me's problem rather than current me's problem.
Then
so I'd like to pay it later.
Okay, then go with a low deductible, but you're going to have high copay. You might also have high co-insurance. You're certainly going to have a high deductible.
What is co-insurance?
That's the stuff that doesn't fall under the copay, but still is responsible for you.
What?
Yeah, remember? Okay, fine. You got the premium, which is the now money, and then you got the deductible. But on top of the deductible, you either have to pay the copay or the co-insurance every time you see a doctor.
This seems inefficient to me.
This is what we get.
We didn't stumble onto this system by chance. The reason all of this exists is because of a very important research study done a couple of decades ago. It's probably the most ambitious, largest study of health insurance that has ever been done or ever will be done. It was called the RAND health insurance experiment, and I'm going to tell you all about it in this week's Healthcare Triage. The RAND Corporation is a think tank that was established in 1948. They perform research in all kinds of areas, including health. And in 1972, they began an 11-year study of health insurance. You see, there was an ongoing debate about how insurance affects spending on healthcare in the United States. A number of people thought that insurance caused us to spend more than we otherwise would have on healthcare. It's part of what we refer to as the moral hazard. Basically, the moral hazard is the idea that people who are insulated from risk behave differently than people who are exposed to it. For instance, if you have good car insurance, you might drive less carefully because you're more protected. In healthcare, some apply the moral hazard to say that once you have good insurance, you're more likely to use healthcare, even if you don't need it. In my favorite example of this, because I find it amusing, not because I agree, if we all had employer-paid grocery insurance, we might all demand filet mignon instead of hamburger. This would evidently lead to skyrocketing food costs, mass starvation, and huge piles of rotting ground beef. It's important to understand that people who apply the moral hazard to healthcare believe that people are using too much of it, and that's why our costs are so high. They believe that if we somehow changed how we pay for healthcare and exposed people to the true costs, they would become better consumers, and the whole system would cost less. As a theory, the moral hazard in healthcare was first described only about 40 years ago in a seminal paper by the economist Mark Pauly. And it's still just a theory. Like many theories, it has good parts and bad. It's not an undisputed law. For instance, recent work by another economist named John Nyman explains that the moral hazard may actually do good in healthcare by encouraging people who otherwise wouldn't get care to do so. We want sick people to get care. And think about it. That supermarket example isn't even remotely comparable. If I made colonoscopies free tomorrow, no one would start picking them up by the dozen. If I declared that no one would ever have to pay for chemotherapy again, you wouldn't ask for extra. If surgeons refused to accept payment for appendectomies anymore, would anyone go and get one just for the hell of it? We have a hard enough time getting people to do the things we want them to do to be healthy without making it harder for them to do so. Anyone who loves meat loves filet mignon. No one loves going to the doctor. What really matters is whether people are getting unnecessary healthcare. What we'd really like to know is whether people would spend less if the moral hazard was removed, but stay as healthy. If that's the case, it's a good argument for making people pay more of their own bills. But if they get sicker, then it's a good argument for insurance covering all the costs. If you want to see if one thing causes another, though, you need a randomized controlled trial. You might think that a randomized controlled trial of health insurance would be incredibly difficult. You'd be right. There have been 2 that I know of in the history of the United States, and the RAND health insurance experiment is by far the biggest. It contained about 2,700 families, made up of people all under the age of 65. They came from 6 places across the United States to give it a nice geographic spread. And they were all randomly assigned to one of 4 levels of insurance coverage. They ranged in how much individuals had to pay in coinsurance, from none to 25%, 50%, or 95%. In other words, they measured different levels of the moral hazard. The none plan would involve no costs at all to people. The 95% plan is much like a health savings account, where almost all of the spending is out of pocket. The researchers' interests were varied, but centered on spending and health outcomes. The purpose of the study was to see if increasing the amount of cost sharing would change how people used healthcare and how their health was affected. The results are complicated and have been interpreted and misinterpreted too many times to count. But here's the gist of what they found. People in the high deductible plans, those who are most exposed to healthcare costs, did spend significantly less and they consumed less healthcare. And yes, much of that care was unnecessary, as healthy people did not suffer negative consequences from foregoing care. Removing the moral hazard did no harm in the majority of patients, which is often touted as the result of the study, because they were healthy. And of course, getting less care when you're healthy leads to few short-term negative results. So it quickly became accepted fact that increasing cost sharing was a good thing. People would use less care. They'd spend less. Insurance expenses and therefore premiums would come down. Everyone wins, right? This is why we have deductibles, copays, and coinsurance. But, and this is important, there were other findings in the RAND health insurance experiment. Poorer participants with hypertension saw their mortality rates rise significantly. They died more. This is because it turns out that people are pretty bad at telling the difference between necessary and unnecessary care. If you're not healthy and you aren't rich, then you're more likely to go without necessary care, and you're more likely to die. This debate isn't over. You can still find lots and lots of arguments from people who think that we're still too shielded from healthcare spending. They want high deductible healthcare plans, or even the elimination of all comprehensive insurance where only catastrophic things are covered. People who push for this believe that removing the moral hazard will not hurt people and will lead to significantly reduced healthcare spending. They're not totally wrong. Removing the moral hazard is fine for most people. Yes, if we make it more expensive for individuals, if we demand more skin in the game, if we remove the moral hazard, people will seek less care. And that's fine for healthy people, but it's terrible for those who are ill. So as we continue to reform the system, keep this in mind. Higher deductibles, copays, and coinsurance may be good for overall healthcare spending, but they may be bad for people's health.
Why we need government-run, universal, socialized, call it whatever you want, health insurance. Alright, so we all know from basic civics class and just being alive that a lot of essential services are already government-run, universal, socialized, whatever you want to call it. Think water treatment, police, fire, postal service, Coast Guard, all those things you know are going to be there for you every single day without even thinking about them. We all pay our taxes, and the government uses the money to pay for the things everyone needs just to get by. Now, healthcare is just as essential as any of these services. Sure, a few of us may be lucky enough to make it through our whole lives without some kind of medical problem, but the rest of us depend on healthcare at some point during our lives just to get by. Besides its essentialness, there's another reason health insurance is just like those other government-run, universal, socialized, whatever you want to call them services. That's this. Very, very, very few people can afford to pay, all on their own, the cost of healthcare when disaster strikes and they or someone they love gets really, really, really sick. So we all need insurance, which basically means we need to pool our money together enough so that when any one of us gets really, really, really sick, there's enough money in the pool to pay for that person to get better. That's insurance. But who should we choose to manage the pool of our money and dole out the money to the people who need it? Well, private insurance companies are the ones who do it right now. But there's a problem. On average, these companies take out 10 to 20 cents out of every dollar we put in the pool. Some of that 10 to 20 cents they spend on administrative costs, processing paperwork and paying for ads to get more people to sign up. But some they use for things that aren't even remotely connected to caring for people's health, like paying for political campaigns to fight against health insurance reform, for example. Of course, some of the money they just take out as pure profit. Who gets the profit? Investors, generally wealthier people who have money to invest. Now, insurance companies are ultimately responsible, accountable to their investors. The more profit the executives at insurance companies make, the bigger their bonuses. It turns out that one of the best ways of increasing profit is denying people coverage for their health problems. That's why insurance companies try to do this as much as they think they can get away with it. Which brings us to the biggest reason why we need government-run healthcare. Profit wouldn't be part of the equation. That means the government would spend more of our insurance pool on actually caring for people's health. Probably much more. The Medicare program, for example, a real live model of government-run health insurance, only takes 2 or 3 cents out of every dollar in the pool for administrative costs. They take 0 cents out for profit. That means more money goes to actually curing sick people. Some people seem to think that government health insurance could never be as efficient as private free market insurance. I'm not sure why they think so. The government certainly runs lots of other essential services really well. Police, fire, water treatment, all those services I talked about before. Just imagine if instead of being public, government run, and free, you had to buy fire insurance like people buy health insurance today. First, you'd have to try to understand a 100-page fire insurance policy with lots of legal terms nobody but fire insurance lawyer specialists can understand. Then either you or your employer would have to pay the insurance company with money from your paycheck to join the plan. Then, of course, 10 to 20 cents out of every dollar you gave the company would go to administration and profit instead of hoses and other tools. And what if there were a fire? You'd have to call around and make sure you found a fire station that was in your insurance company's preferred provider network. Then the fire trucks would come and put out the fire, but wait, that's not the end of the story. It may turn out that the small print fire insurance legal language in your policy says that the particular type of fire in your house wasn't covered by your insurance plan. Or maybe you had a pre-existing fire burning in your backyard barbecue, so the insurance company won't pay the firemen. Now you owe the firemen hundreds of thousands of dollars. You'd mortgage your house to pay them back, but it's not worth much because it was so badly burned in the fire. It turns out that fire insurance is just fine the way it is. Free for everyone, paid for by our tax dollars with nobody skimming profit off the top. And that's the way health insurance should be too.